Let's talk a little bit about mental health resources. Managing the worry associated with a diagnosis or concerns about relapse, or even various side effects can lead to emotional symptoms like anxiety and fear. Why is it important for people with AML to share how they're feeling with their healthcare team?
So I think it's very important because one, all of those feelings are normal feelings. I think they're symptoms that from going through such a rapid diagnosis and then having to start treatment pretty quickly and going through all the ups and downs with these types of diagnoses can really lead to, for some patients, PTSD type symptoms. And then there are also things that can evolve over time where their anxiety or even survivorship guilt as you go, if you move forward and are doing well, where you may have some friends or people you met along the way who may not have had as good outcomes. And so there are resources available based off of where you are, but for survivorship, oncology specific counseling to deal with some of these feelings that are understandable and normal for what patients have been through.
Can a social worker help? And are there other people on the healthcare team who can support a patient's emotional needs?
Oh, absolutely. So I think it's really, place dependent on where you are. But yes, absolutely. Social workers are a great resource for patients. There may be other collaborative teams based off of where you're receiving your treatment that may be available. There may be patient support groups where you can go and be with other patients, or Facebook, social media support groups. And I think all of those can be very helpful. And I know at least at our center, we also have patient kind of mentors who have kind of been through and gotten through, to the other side of transplant or whatnot, who are great resources because they've lived and experienced it. And I think that's just, as a physician, I can talk about things, but I don't have that personal experience having lived through it. And I think that's very important
Yeah, it
to be able to
certainly
have
is.
someone to talk to. Yeah.
Yeah. What about the financial aspect of treatment? There are many people who would find it difficult to find, and maybe they don't have insurance or their insurance doesn't cover a lot. How do you help patients who are dealing with financial restrictions?
Sure. So I think that, we're fortunate here because we have a lot of support staff to help patients with our financial counseling team. We also have people within the medication assistance programs who can help find, foundational grants to help with medication support, travel support. I think for patients who may not have those things available at their individual center, the Leukemia and Lymphoma Societies are a great place to reach out for, and there are other foundations as well who at least may have navigators to help patients figure out other resources or funding available.